I grew up in a very modest environment. My dad was a lifelong politician. He was in the Connecticut State Legislature growing up, and I grew up in a family that service meant a lot. And I took that to heart, and I've really tried to apply that in my healthcare career. My healthcare career had an interesting start. I didn't know what I wanted to do when I went to college, and I had to put myself through school, so I worked as an EMT. And that's how I was introduced to healthcare, and I've been doing that my entire life. I started my career at Bay State Medical Center and had an opportunity to work at the University of Vermont. I also worked at York Hospital, which became WellSpan Health. And then I worked in Washington, D.C. for quite a long period of time, which was nice because I had done a short stint there in high school working for a senator. And going back to D.C. was wonderful, and it really gave me the bug to do what I'm doing now at the association, which is to get involved in advocacy and try to help move the field along. I then had an opportunity to work at Johns Hopkins for several years, and came to the Atlantic Health System 3.5 years ago, and my whole career's I've been blessed, and it's been incredible. There have been many things that have impacted me, and particularly on my journey in healthcare. Some have been incredibly powerful. Some have been very sad. And I think it's that confluence of factors. But there's so many powerful things that we see our teams doing each and every day in healthcare. So when I need a break and I want to kind of clear my head, I end up roaming into our clinical areas. It's not unusual throughout my career to see me end up in the emergency department, because as an EMT, it's a place you feel comfortable. But that gives you a renewed sense of purpose, because the people who work in healthcare do such special things each and every day. That just gives you energy. The first is about access. And it's not just access to care, which is obviously critically important, but it's access to insurance. And I think that is very timely right now. The second thing is this issue of affordability. It's been my belief through my entire career that there's been this huge disparity with people who can afford healthcare versus those who can't. And I really think that we have to take these issues of affordability very, very seriously, and we have to take the lead in that, even though it's going to require the participation and cooperation of others, like insurers and drug companies. The third thing that's really important to me is to make sure that we're inclusive in those conversations. Healthcare more and more is a team sport, and we have to engage our partners differently and more inclusively. As a board chair, I am really looking forward to continuing my journey throughout the country, seeing all of our similarities as well as all of our differences. Because as we address these issues of access, affordability, and inclusion, we have to always take into consideration from where people are coming. And as you have an opportunity to travel throughout the country, whether you're in a small rural area or an inner city or anything in between, having that knowledge and seeing firsthand the challenges that our members have is very, very important.